Have you ever noticed that we spend an incredible amount of time teaching ostomates how to survive, but almost no time teaching them how to live afterwards? Every year, thousands of people undergo life-changing surgeries, like ostomy surgeries. They learn how to clean their wounds, how to change an ostomy appliance, how to manage medications, how to prevent a complication. And those things are absolutely essential. But eventually, someone goes home. And then the questions begin. Will my partner still want me? Will I ever feel attractive again? What if my bag leaks? What if it makes a noise? What if I physically can't have penetrative sex anymore? What if no one ever touches me again? These aren't medical questions, they're human questions. My name is Trina Ricketts. I'm an ostomate, an intimacy coach, an author, and someone who has spent years helping people rebuild confidence, connection, and intimacy after illness, disability, and body-altering surgery. Every week, I hear stories that literally break my heart. People who haven't allowed their spouse to see them naked in years. People who stay in sexless relationships because they just believe intimacy is over. People who won't date because they're afraid of rejection, and partners who desperately want to reconnect but are afraid of causing pain. People who believe that because their bodies have changed, they are no longer desirable. The truth is that most conferences and events prepare people for surgery. Far fewer prepare them for everything that comes after it. And recovery isn't just physical. We know it's emotional and it's relational and it's deeply personal. And when we ignore intimacy, we leave people grieving a part of themselves they often don't know how to get back. That's the conversation that I bring to your event. Evidence-informed, practical, hopeful, human-based conversations. I help people understand that intimacy is far bigger than intercourse. Confidence can be rebuilt, and touch matters. People whose bodies have changed are still worthy of love, affection, desire, and meaningful relationships because they're still beautiful. They're just beautiful in a different way. My presentations leave people with practical tools they can actually use. I talk about how to rebuild intimacy after months or even years of distance, how to have conversations with a partner about fears, changing bodies, and changing needs, when and how to tell someone you're dating that you have an ostomy, ways to manage fears around leaks, scars, and altered anatomy. What intimacy can look like when penetrative sex isn't possible, including affectionate touch, emotional connection, and even fake lay positions that allow couples to experience closeness without penetration. I explore body image, touch, starvation, confidence after medical trauma, and practical ways to help partners reconnect emotionally and physically. And most importantly, I create space for conversations people have often wanted to have for years, but never felt safe enough to say out loud. I believe every event or conference that supports people living with life-changing medical conditions should include the emotional and relational side of healing. Surviving surgery is only part of the journey. People deserve to laugh again and feel beautiful again, to be held without fear, to reconnect with the people they love, and to discover that intimacy is still possible, even if it looks different from how they did it before. So I hope you've enjoyed my little video telling you about what I would cover at your event or your conference. And if you have any other questions, please feel free to reach out and let me know. And if there are certain topics that you want me to cover that are more important or topics that you'd rather that I leave out, that's all things that we can talk about and negotiate. I hope you have a wonderful day.